Neuroblastoma, unlike what it sounds like, is not a brain tumor. It's oftentimes confused with some of the brain tumors in pediatrics, and so about 25% of pediatric solid tumors are brain tumors. This represents about 7% of all pediatric cancer, and it presents typically as an abdominal tumor, often near the kidney and the adrenal gland. And so neuroblastoma is a disease of the peripheral developing nervous system in very, very young children. Our typical patient is less than 5 years old, and the average age at diagnosis is about 18 months. We've been working for the last several years working on identifying neuroblastoma cancer stem cells as one of the possible new targets for this disease. The primary cause of fatalities from this disease is relapse. So after the children have completed therapy, or even while they're on therapy, their disease becomes resistant and it comes back. And that's thought to be driven by a subset of cells in the cancer that have stem cell-like properties. So working on that hypothesis, we've been able to identify a population that's very tumorigenic and appears to meet some of the criteria of cancer stem cells. So I've been working on ways of targeting this population, and hopefully we can bring these to the clinic in the future. The ultimate goal of our research in the lab, as a clinician, I see children with neuroblastoma who succumb to their disease, and also other types of solid tumors where basic science is really important to advance therapies to the clinic. So our ultimate goal is to cure every child with neuroblastoma. That's probably unlikely, but it's an aspiration that we all have as pediatric oncologists.